Joining us now, Dr. Peter Shearer, Chief Medical Officer at Mount Sinai Hospital in Brooklyn. Dr. Shearer, we read the grim reality check that you gave us, I think in New York Magazine, your New York Magazine journal. Tell us of the situation now in the emergency department. What are you facing every day?
Right. Thank you very much, Andrea. It's the emergency department. It's the whole hospital. It's our intensive care units. The numbers are continuing to increase that we're seeing. So the emergency department here in Brooklyn has been surging to about a little more than double its capacity. The hospital census itself, we've increased it. Normally we're a 200-bed community hospital. We're up to about 240 patients currently. Over 180 of those are COVID positive patients. So it's just been incredibly active. Meanwhile, a lot of, unfortunately, some staff has gotten sick with coronavirus, so they're out. So the current nursing staff is, been working just incredibly diligently for the past week. This has been increasing, and working with more sick patients than they usually might have, and even at times with shorter staff. So everyone is really this is stretched very thin and doing a really an amazingly heroic job.
We've been reading out of Spain, which of course is one of the countries with a real surge, that as many as 14% of frontline healthcare workers are becoming infected themselves. Do you have any sense of how many of your staff have come down with this?
It's about 10 to 15%. And they've been working for the most part with adequate PPE. All the time. There are times when things happen and there's a surge where all of a sudden a patient goes into respiratory arrest, and you suddenly need to have, instead of one nurse, you need to have one nurse and an X-ray tech and a respiratory therapist and doctors in the room all at once, and then PPE gets consumed very quickly. But it's about 10 to 15%.
Which is really horrendous and amazing that they are willing to keep doing this and put themselves and their families on the line this way. Talk to me about some of the search for some of, and for more days and longer shifts, I know, than they would normally be doing. I wanted to ask you about some of the possibly hopeful signs, some of the new techniques, the plasma, which is being used from recovered patients that might have antibodies. I know of specific cases. Can you tell us how that is working? Whether you know that it will work? We even know of people who are having this treatment right now.
Right. So, you really have to talk to the really more the investigative medical specialists out there. Certainly, they're starting to work on identifying the recovered patients that will be the ideal candidates for donors, and then can begin a apheresis program for donating such. But nothing's been done now. This is all really experimental or investigative, and very hopeful.
The president keeps questioning the need for ventilators and even suggesting in his news conference last night something really untoward, potentially illegal, unethical, that was going on in New York, hoarding, or as he put it, something worse. We have looked into this. We have not heard of anything like that. Have you? What is your experience with the ventilators and the other protective, in particular, the PPE?
Right.
As to whether or not health workers are doing something with masks.
As far as ventilators go, I can't imagine anything like that. Every hospital needs to have more ventilators at the ready. We've been running on a margin around 5 to 10 available at any time, and we know we're getting some shipments of sort of rescue support ventilators in. Every time we get any of those, it takes a certain number of staff members to be able to unpack them and provision them so they can actually provide the life-saving care that they're intended to give. But certainly no ideas of these being hoarded. As far as other PPE, there's initially, when this all started, we did notice when there was a lot of fear and all of a sudden masks started flying off the shelves of every drugstore out there. They were disappearing from the hospital as well. And whether that was staff or patient families or whatever, there's a large fear. But I think that's really sort of has started to diminish as people have recognized the severity of this and they need to have the PPE in the hospital. And most hospitals like mine are also keeping a very close watch, making sure that it's at the right place at the right time when staff needs it.
Well, Dr. Peter Scheer, thank you. Thanks to you and your courageous colleagues for everything that they're doing for our communities. And we'll stay in touch and get updates from you as we go along through this crisis. Thank you so much, sir.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.